My name's Raluca. We're going to go ahead and administer Mr. Smith's medication through a Piggy bag. And we're going to go ahead and we're going to start by checking the doctor's orders. We're following standard protocol. So Mr. Smith has been dealing with an infection. So we want to go ahead and get him his antibiotic, Racefin. We know that Racefin is a bactericidal medication. We want to make sure that we teach the client to make sure he takes his antibiotics even when he doesn't feel any more symptoms, just to make sure we don't have a rebound effect, we don't have any rebound infection. We want to make sure that we check the patient's labs, so ALT, AST, bun, creatinine. We want to make sure that we look for white blood count cell, just to make sure that the patient is actually getting the right medication that will help him. Also, we want to make sure we get a culture before we actually administer the antibiotic to make sure that we're dealing with the right antibiotic. So now we know that we are going to infuse the antibiotic over 30 minutes according to the doctor's orders. We also know that we will infuse it in the 50 milliliters of sodium chloride. We know from the tube that the drop factor is 10. And we also know that we have a prescription for 1,000 milligrams. We have 500 milligrams is into 1 milliliter. Therefore, we'll have 2 milliliters that we have to administer. Also, because we're infusing it over 30 minutes and the drop factor is 10, we'll have 17 drops per minute. So now I'm going to go ahead and gather all my supplies and head to my patient's room. All right. How are you doing today, Dr. Smith, Mr. Smith?
I'm alright.
Alright, well, my name's Raluca. I'm your student nurse. And today we're going to go ahead and get you a piggyback medication. It's your Racefin. Do you have any allergies to latex, any penicillins or cephalosporins?
No.
Alright, perfect. So there's no allergies. Can you also state your first name, last name, and date of birth for me?
John Smith, 4/21/54.
Alright, perfect. So now we're going to go ahead and we're going to start by having hand hygiene. We're going to make sure we wash our hands. We're going to check our medication against our doctor's orders again. Just make sure we have the right patient, right dose, right medication. And also we're going to check the expiration date, so January 2015. We are good to go. We're going to go ahead and start by getting our medication ready. Going to clean up. Get the syringe. And we said we're going to administer 2 milliliters. Okay. Now we're going to go ahead and insert that into our mini bag. Alright, the needle will be going into the sharps container. Just go ahead and get that. Sharps container, and then we're going to go ahead and mix our bag. Just slightly mix our medication. Now we're going to go ahead and document the patient's name, the type of the medication, the dose of the medication, the date, the time, and my initials. And now we're going to go ahead and insert to the needle's device. Okay. we're going to go ahead and prep our INT. And I'm just working perfectly fine. Just put this back on. Alright. Now we're going to go ahead and just do hand hygiene again one more time. And apply our gloves. We're going to go ahead and palpate the IV site for phlebitis. So any pain, heat, edema, erythema, I feel nothing. And no infiltration, so I don't feel like the skin is cold, pale, wet, or leaking. No, the IV site isn't leaking or anything like that. So now we're going to go ahead and hang the Piggy back above the primary IV. So we'll take this. Right up. Okay, perfect. Now we're going to go ahead and clean the port with alcohol. And then we're going to go ahead and flush it with 3 milliliters of saline water. Right before that, we're going to go ahead and aspirate. And make sure this is unclamped. We're going to clamp this one. And aspirate. Looking for blood return. And I see blood return. Now we're going to have and aspirate 3 milliliters. Alright. Get rid of this. Now we're going to go ahead and attach the Piggy back. Alright. We're going to go ahead and unclamp the Piggy back. We're going to set the flow rate. Alright, I'm going to go ahead and take my gloves off. Wash my hands. Check the time. It is 3:30. So, since we're infusing it over 30 minutes, I'm going to be back at 4 o'clock to check on Mr. Smith, okay? I'll be right back. Mr. Smith. Alright, well, it is 4 o'clock. It's been 30 minutes. I'm going to go ahead and walk into my patient's room. Alright, Mr. Smith, I'm going to go ahead and wash my hands and apply clean gloves. Okay, let's try this hand. Alright, I'm going to go ahead and just check the medication has been administered. So now I'm going to go ahead and I'm going to clamp the Piggy back. Unclamp the primary. But first, I'm going to get rid of the Piggy back. And the Piggy back is clamped. And I'm going to go ahead and infuse 3 milliliters of saline. And I'm going to make sure that I'm using the push stop method. Alright, I'm going to go ahead and clamp this off. I'm going to unclamp this, unclamp the primary. Okay, now I'm going to go ahead and set the flow rate again. Make sure we're reestablishing the same flow rate. I'm going to dispose of any needles, sharps, any things that we don't need in the patient's room. I'm going to go ahead and monitor the site for pain, swelling, tenderness, or redness. And now I'm going to go ahead and make sure I document the MAR, the time, drug, the rate of the drug, the type of drugs. I'm going to go ahead and make sure I document how the patient is, how the skin of the patient looks at the infiltration site. And then also I want to make sure that I record the fluid volume and the input and output. And that is it.